Welcome health insurance companies, American Medical Association, pharmaceutical companies, American Health Association, and members of the U.S. Department of Health and Human Services. Approximately 28 million Americans are uninsured, and you may ask, why is this an important fact to know? After this presentation, based on information from Internal Medicine Journal issue of June 2017, you will have the information needed to answer that question. The authors of this article, Relationship of Health Insurance and Mortality, Is Lack of Insurance Deadly?, researched several studies concerning the relationship of insurance and mortality. The evidence strengthens the validity of the Institute of Medicine's earlier conclusion that health insurance saves lives. The odds of dying among the insured are significantly less than the uninsured. Let me share with you some additional information I obtained from this article. Key points to think about. Several studies found that uninsurance shortens survival. The lack of coverage is associated with lower usage of recommended preventative services, which leads to the development of chronic disease conditions and increased mortality rates. One study found that coverage in the near elderly slowed their decline in health and decreased mortality. The Institute of Medicine's finding on the health status of non-elderly adults reinforced the theory that the uninsured have poorer health and shortened lives. The Institute of Medicine Committee also reviewed evidence on the effects of health insurance in specific circumstances and medical conditions. The findings determined that uninsured patients, even when acutely ill or seriously injured, cannot always obtain the needed care. Another study found that uninsured patients with cancer presented with more advanced disease and experienced worse outcomes. A third study confirmed that uninsured patients with diabetes, cardiovascular disease, end-stage renal disease, HIV infections, and mental illness have worse outcomes than did uninsured patients, and that uninsured patients received less care and inferior quality care and had higher mortality both during their hospital stays and after discharge. The case for insurance coverage is strong. Coverage improves the acceptance of essential preventative services and chronic disease management. Well-recognized benefits of health insurance are improved self-evaluated health, financial protection, reduced likelihood of depression. Health insurance coverage gives people the access to medical care with a goal to not just save lives, but to relieve suffering. I trust in the findings of this article. It confirms that the additional studies completed since the Institute of Medicine's 2002 report